thing I'm going to do, can you point to exactly where it hurts?
Just right here.
Okay. Do you mind if I just pull down your shorts a little bit just to take a look at the area?
No.
Okay. Just going to take a look at this side. Right in there? Is that where it hurts?
Yeah.
Okay, so it's tender in there to touch?
Yeah.
Okay, because I feel a little bit of swelling there over the greater trochanter. I'm just going to feel side to side to compare for heat, if there's any difference. I feel a little bit of redness difference. There's a little bit of redness that I see, and I notice a little bit of swelling. No apparent deformity at the greater trochanter other than a little bit of swelling, and I'll determine altered function in a second. I'm just going to run you through some range of motion first so we can figure out what might be limited. So the first thing I'll have you do is we'll test out this leg first. So what I'll get you to do is just keep your leg straight and then raise it as far as it goes. And do you have any pain when you do that?
No.
Okay, I'm just going to have a little bit of an overpressure to see. Any pain with that at all?
No.
Okay. So I get a tissue stretch with that one. Then can I get you to do the same thing with your right leg? Okay, so it's about the same for active range. Do you get any pain with that? No. Just going to do a little bit extra. Pain with that at all?
No.
No? Okay. So it's also a tissue stretch. And I had about the same range bilaterally with an overpressure. The next one can I get you to do, you're going to keep the leg straight again on the side, but you're going to, instead of putting it out in front of you, you're going to reach it out towards that wall as far as it goes. Any pain with that?
No.
Okay, so it's about 45 degrees. Any pain if I add pressure to it?
No.
Okay, I get a tissue stretch with that one. Can I get you to do the same thing with your right leg? So it might be a little bit greater range of motion with abduction. Do you have any pain with that one?
Just a little bit.
And where do you feel it?
Right here.
Is that that same like aching pain that you've been talking about? And what would you give it on a scale of 0 to 10?
Like a 3.
3? Okay. And just relax your leg for a second. Let me know if you start to get pain throughout the range.
Yeah, like right there.
Pain there? Okay. And any pain right at the end?
Just the same pain.
Same pain. What would you give it for a number?
Like a 4.
4? Okay. The next one I'll have you do, you're going to pick this, bend this knee, and you're going to cross it over your other leg. So bend your knee. And then you're going to cross it over this leg. Now what you're going to do is bring this leg towards me as far as it goes. Any pain with that one?
No.
Okay. The last one with abduction, I also got tissue stretch at the end. I'm just going to do a little bit of extra pressure. Pain with that at all?
No.
Okay. So I got a tissue stretch with that one. The same thing, I'll get you to do the same thing. So bend this knee, put it over top, this leg, and then you're going to keep this leg straight and point it towards me. Any pain with that?
Yeah, a bit.
You actually have a bit greater range with abduction on this leg than the other one. Where do you feel the pain?
Same spot.
Same spot? Right on top of here?
Yeah.
Right there?
Yeah.
Okay. And what would you say for a number for your pain?
Like 5.
Okay. Just keep this leg up and relax this leg for me for a sec. I'm just going to put on a bit of a stretch. Pain with that at all?
Yeah.
What would you give for a number now?
Like a 6.
Okay. So passive range, I had a little bit of muscle spasm before I got to the end feel. And range. The next one I'm going to have you do is you're going to bring this leg up, so bend this knee. I'm going to leave it there. And then what you're going to do, so hold that for me. What you're going to do is try to bring your foot towards me, bending at the knee. Do you have any pain with that?
No.
Okay, I'm just going to do a little bit of added pressure. Pain with that at all? Okay. So I got a tissue stretch at the end. And I'll now have you bring this towards me. Pain with that at all?
No.
Pain with that at all?
No.
Okay. So a little bit of clicking in your knee. I get a tissue stretch at the end. I'll have you bend this knee up as well. A little bit further. Do you have pain when you do that?
No.
Okay. The next thing, so bring your leg towards me to start. Do you have pain with that? No? Okay, it's about the same range bilaterally with internal rotation, and then if I add pressure, any pain?
No.
Okay, I get a tissue stretch at the end field, slightly greater range with internal rotation on this side, and then I'll have you bend it the other way, so towards that wall. And any pain with that one?
No.
Pain with that at all?
No.
So slightly greater range with external rotation on this leg. The next one I'll have you do is, can you flip over to your stomach for a sec? And then you'll keep your leg straight the same way, but now this time you're gonna just start this one, raise this leg off the bed. Good. Is there any pain with that?
No.
Okay. And then I'm just gonna do a little bit of an overpressure, so relax your leg for a second. Pain with that at all?
No.
Okay, so I get a tissue stretch. Do the same thing with this leg. Do you have any pain with that?
No.
No, I'm just going to do a little bit of an overpressure. Slightly greater range with my overpressure on this side. Any pain with that?
No.
No, okay. Good. So it's a tissue stretch on both sides as well. The next one, I'm just going to test your strength while you're in this position. So I just want to, what I'm going to do is I'm going to push down, start over here, push on the back of this leg, and then what I want you to do is, I'm just going to push down. I just want you to resist my movement.
Okay.
So, actually bring your legs slightly up off the bed. Good. Now I'm going to push you down from here, try to resist. Good. Any pain with that one?
No.
Okay. Do me a favor, bend your knee for a sec. And then same thing, lift this. Okay, try to hold this. I'm going to push you down.
Okay.
Any pain with that?
No.
Okay, so strength with the leg extended on the unaffected side is 5 out of 5. The glute max strength that I tested is about 4+ out of 5. Do it again for me. I just want to see what your back's doing in comparison. So, go again. And relax. Okay. I'm going to test your firing really quick. So try to, what I want you to do is try to lift your leg actively. So just by yourself. Go ahead. Good, and relax. Okay, so hamstrings fired, then glutes, then rector spinal. So bring this leg up again, keep it straight, and then I'm going to push down, try to resist. Good, any pain with that?
No.
Okay, strength was 5 out of 5, bend this knee. Same thing, bring this off the table, and then try to resist. Okay, so strength for glute max was 4+ out of 5. Next thing, I just want to test your firing on this side too, compare it bilateral. So try to raise your leg again. Okay, and relax. Go one more time. And one more time for me, sorry. Good, relax. So your rectus spinae fires before your glute, before your hamstring on this one. The next thing I'll have you do, can you lie on your side for me? Doesn't matter which side first. So straighten your legs, and then without locking your knee. So this is your sore side, right?
Yeah.
Okay, okay. So what I want you to do, raise your leg off the table. Good, hold it there. Now I'm going to push you down, try to resist. Good. So for hip abduction, making sure the hips are stacked. Strength is 5 out of 5. Now bring your leg up again, and I'm going to have slight, just relax for a second, straight external rotation. Now hold your leg here. Make sure you're stacking those hips. Good. Now I'm going to push down your leg. I'm testing for glute med. Try to resist. Good. So strength was about 4+ for that 1 out of 5. Do you have any pain with that?
Just a little bit.
On the same spot as before?
Yeah.
And what would you give it for a number?
Like a 5.
Okay. Can you flip on your other side real quick? I'm going to test the same thing. So you're going to keep this leg straight for me, lift it up off the bed, and I'm going to push down. Any pain with that one?
No.
Okay, and then bring it up again. Keep it straight. Keep those hips stacked. Keep your legs straight. Good. Just relax for a second. Good. Hold that. I'm going to push you down. Try to resist. Good. So glute med strength was better on that side. It was 5 out of 5. What I'll have you do next is just lie on your back for me. Put your legs out straight. Lift this leg up, off. Keep it straight. And I'm going to try to push you down, so try to resist. Now bend your knee. And I'm going to push this way, so try to resist. Good. So hip flexion with the knee bent and straight was 5 out of 5 on the unaffected side. Was there any pain with that at all?
No.
Okay. Same thing, so keep it straight to start. And I'm going to push down, so try to resist. Any pain with that?
No.
Okay. Now bend your knee and try to bring it towards your chest. Pain with that at all?
No.
And the next one I'm going to do, I'm going to go back to the side. Just bend your knee out for me. And what I'm going to do, I'm going to try to turn you out this way, so try to resist. Pain with that at all?
No.
And if I try to turn you in, try to resist. Good. Pain with that at all?
No.
Okay, bend this one up. So with internal and external rotation on the unaffected side, strength 5 out of 5. Then I'm going to try to turn you out first, so try to resist. Any pain with that?
No.
Okay, strength was 5 out of 5 for external rotation. Now I'm going to try to turn you in, so try to resist. Good, so strength was 5 out of 5 for internal rotation. Any pain with that?
No.
No, good. No rubbing over here, no soreness over here at all?
When you're pressing it, yeah.
Oh, there was a bit? Or like when I was doing the movements?
No.
No, nothing like that. Okay. So I'll do a quick test to make sure it's not in the joint itself. So you can relax this leg for me for a second. Bend this knee and bring it up. What I'm going to do is I'm just going to do a compression test into the joint. It'll help figure out if the pain's more in the hip joint itself or maybe something that's around the hip instead.
Okay.
So this is what we call the scour test for a labral pathology potentially. So just relax your leg for me for a sec. What I'm going to do, I'm just going to compress the hip into the joint. Let me know if there's any pain throughout all this, any of this. Pain with any of that at all?
No.
Okay. I don't notice any clicking or blocking in the hip at all. And bend this knee up for me. I'm going to do the same thing. Any pain with that?
No.
No pain with that at all?
No.
Okay, and I didn't notice any clicking or locking. Do me a favor for a second. What I want you to do is, I'll test on this side first. I'm just going to see if there's any like crepitus or rubbing over the IT band snapping over the greater trochanter. So what I want you to do to start is just actively extend, so just bring your leg out straight towards me. Good, and back to the middle. Okay, I notice a little bit of rubbing. Now bend your knee. You do the same thing, so keep this leg up, like off the table. Keep your foot off the table. And now bring this towards me. Good. Do you have any pain with that?
No.
Okay. It's the same thing with this one. Keep it straight for me for a second, and then bring it up towards me. Okay, and back. I didn't notice any snapping. Did you feel any snapping or clicking? Was it painful to touch when you did that?
Just a little painful to touch still, yeah.
A little bit. Okay. So, as far as I can tell, you might have, because of the swelling around the greater trochanter and potential bursitis, we'll refer you for some imaging that might confirm my suspicions.